We've been going to each of the town councils, the 6 town councils that we are part of. And what we're doing is an update with them, and it's really 4 different areas that we're updating. We're talking about our financial situation, and where we are there with a projected potential deficit of about $3 million at year end, despite having received some funding at the beginning of this year. The second area that we're talking about is our capital and our infrastructure needs in the organization, because I think it's important for people to be aware. We have about $9 million between the 2 sites of capital or equipment needs, and approximately $30 million of infrastructure investments that are required over the next number of years for both of our sites together.
Okay.
So that was the second area we talked about. The third area is around the funding we've just received from the Ministry of Health around our stage 1 and stage 2 planning. And the fourth area that was really a delight to share with the councils is the areas of successes that we've experienced at Muskoka Algonquin Healthcare, which is really as a result of the phenomenal care and efforts that our staff, our frontline staff and our physicians display every day in the organization. So it was really quite a pleasure to share numerous examples of successes that we've had at MAHC.
Now, I guess the biggest issue is this state, or not really an issue, the concepts that were really focused at council were the stage 1, stage 2 components of your planning. So can you tell the viewers out there who are watching right now, what is the stage 1 that was approved?
Sure, I'll be pleased to do that. As your viewers may remember, we did submit a pre-capital submission to the Ministry of Health that was approved. And then we were in a bit of a hiatus. So in April, May time period received the go-ahead from the Ministry of Health, but we were asked to embargo the information, and they instructed us at the time that they were giving us up to $1 million to do stage 1 and stage 2 planning. Clearly, you can't get into stage 2 planning until you've completed stage 1, and that's been approved. So what's happening in stage 1 planning is a plan to do a further refinement to the models that we looked at previously before we got to the decision that the board made, as well as introducing any other models that we believe need to be looked at again. In that process, what we would be doing is looking at the newer census data that's now available. So redoing the numbers that we had in the past, looking at, and I would say really looking at what's changed in the healthcare environment. And I think there's been a lot of changes that Muskokan area have actually seen or witnessed. And that would be the MAHC group. So the Muskokan Area Health System Transformation is definitely changing the landscape here in Muskoka, as well as some of the priorities that the ministry has come out with in terms of investments in community and primary care, putting the patients and families first. So our landscape has changed. So part of what we will be doing in stage 1 planning is to bring those factors and those variables into play as we look. So in a way, I would say we're writing a new chapter.
Okay, so I was going to ask that. So then to confirm, because the board had at the time voted in favor of the 1 hospital model. So now are you saying that because of all these other factors that are coming into play, you're almost looking at it again and another vote will happen again? Is that as to what model works best?
Yeah, I don't know that I would call it another vote, but yes, what we would be doing is looking and seeing what options make sense today. And I think that's one of the commitments that I believe we at Muskoka Algonquin Healthcare have said on a regular basis, that we will continue to evergreen or re-engineer or look again at data that's coming out to make sure that as we're in points of time, that point in time or that decision that was made still holds true as you move into the future. And so given the changes that we've experienced over the last couple of years, it will be looking at what makes sense today in terms of the variables we have today. So we'll be, as I said, sort of writing a new chapter.
Now, I guess maybe I'll just frankly ask you this though, just based on discussion, I know you're going to be looking at it, but is it still the favorable option? Not that you're going forward with this option, but is the 1 hospital model still a favorable option for years to come? And I know it's not happening anytime soon, but what's the flavor like right now with the board?
The board is exceptionally open, so I would say that I don't believe that they're fixated on 1 model at this point, and I would also say that some of the board members, some of them have changed from the previous board that made the decision. So I think there's a real openness to look at models again. So I don't want to speak on behalf of the task force that we're trying to put together, but it's my sense that what the task force may do as their first order of business is look at the three options that were looked at by the planning group in the past, as well as the option that the both town councils, Bracebridge and Huntsville, put forward, and that was the option of looking at one site being the acute care center and the other site being an ambulatory.
Right.
So the potential would be to start with those four options and make a decision around, are there any that could be taken off the table early in the process, and then doing the very in-depth analysis that would be required to get to a point where there would be a recommendation that would go to the board. So the board still has the fiduciary responsibility of planning and deciding on the future,
Okay.
what the capital plan would look like, but they have charged the task force that we're putting in place right at this moment to actually bring that recommendation forward.
Okay, okay. Now, once this, how long then? I mean, it's a stage, right? So it's going to take some time. So in terms of timeline, how long does this stage one take or would take before moving on to stage two?
Well, we're going to take the time it takes, but at this point what we're trying to do is fall in line with some of the MAHC deliverables. So the
Okay.
Muskoka Area Health System Transformation has a due date of March 31st, 2018, in which they've selected about 5 or 6 areas that they want to continue to work on and try to get to some conclusion by that point next year at the end of March. And so we've taken on the same due date, and our hopes are that we'll be able to conclude or finish a good piece of this work by March 31st, 2018. But if it takes us another couple of months beyond that, then it will take us another couple of months.
And then briefly, I guess, just describe before we end off today. Once stage one is complete, what does stage two look like? What is that stage exactly?
So stage two would involve, so depending on the option that's selected,
Yes.
there would be further refinement, and there would also be, should the option selected require site selection, that would occur in stage three.
Okay. Okay.
Yeah.
Well,
Excuse me, stage two.
stage two, right, right. How many stages are there?
There are 5.
Oh, there are 5 stages.
Yeah.
Okay, so this basically, if this is taking a year, this 5-stage could take several.
It very well
will
could.
take, yeah.
We started our planning back in 2012, so if you think about it, we're in 2017 right now. So it's taken us 5 years to get from the planning, the pre-capital, to the beginning of stage one. And if things continue in the way they have in the past, it could take us 30, 40 years before we get to a point where there's actually a new building or a renovation or whatever the option may be actually realized in Muskoka. So my hopes are that we can all get together, know that we're trying to plan the best healthcare solution for all of Muskoka area, work together and move on this so that we can get this to be a reality sooner rather than later. But typically it can take anywhere up to 15 years or more to work through all the stages.